Excellencies, distinguished guests, ladies and gentlemen. It's really a privilege to be here with you today. You don't need me to remind you of the terrible toll taken by cervical cancer. Cervical cancer affects over 500,000 women each year and kills 250,000. One woman dies of cervical cancer every 2 minutes, making it one of the greatest threats to women's health. Each one is a tragedy, and we can prevent it. Most of these women are not diagnosed early enough and lack access to life-saving treatment. If we don't act, deaths from cervical cancer will rise by almost 50% by 2030. Cervical cancer strikes women in the prime of life. These women are raising children, caring for their families, and contributing to the social and economic fabric of their communities. 9 in 10 women who die from cervical cancer are in poor countries. This means some of the most vulnerable women in our world are dying unnecessarily. That cannot be fair or just. But it doesn't have to be this way. Cervical cancer is one of the most preventable and treatable forms of cancer, as long as it's detected early and managed effectively. Prevention and early treatment are also highly cost-effective. HPV vaccines are truly wonderful inventions. The fact that the research that led to the development of vaccines against HPV won a Nobel Prize speaks for itself. If only we had vaccines against every form of cancer. Our challenge is to ensure that all girls globally are vaccinated against HPV and that every woman over 30 is screened and treated for precancerous lesions. To achieve that, we need innovative technologies and strategies. We must improve access to diagnosis and treatment of invasive cancers at their earliest stages and ensure the availability of palliative care for women who need it. All of these services must be embedded in strong health systems aimed at delivering universal health coverage. High-income countries have shown the way. In many of these countries, cervical cancer is becoming a thing of the past. Now is the time for global elimination. During my campaign in 2016, I made a commitment to support the global elimination of cervical cancer. I reiterated that commitment when I was elected as Director General a year ago. But I was even convinced more when Richard Horton called me one morning. And he asked me to talk to Ian Fraser, who is who discovered the HPV vaccine, as you know. And both actually, Richard and Ian tried to convince me. I said, yes, I do, but we have to at least involve the experts to have the strong case to make it happen. But in terms of political commitment, I'm ready. And that's what we're seeing now. Actually, I miss both here. Would have been good if we had both Richard and Ian Fraser here. We have the tools to turn that commitment into reality. But crucially, we also have the political commitment. Several countries and UN agencies have already joined forces under the UN Global Joint Program on Cervical Cancer Prevention and Control, including UNAIDS, my brother will speak later, Michel, and IARC, Chris Wilde, who are with us today. But to succeed, we need everyone on board. We must expand our partnership to include anyone and everyone who can help us reach our goal. That's why today I'm calling for coordinated action globally to eliminate cervical cancer. I'm encouraged. Today we're joined by Gavi, the Global Fund, UNITAID, UICC, and the World Bank. And as the manufacturers of life-saving vaccines, diagnostics, and treatments, the private sector is also a key partner in this mission. And we have already started our discussion with the private sector through IFPMA. We cannot succeed without all of you. Thank you for your everything you have already done. We still have a lot of hard work ahead of us. But I was really encouraged also during our discussion with President Bachelet. She said to me, I would be happy to raise cervical cancer on any occasion that I think is feasible, because I want to advance this cause. And I said, you're the boss, you have it, you know what to do. But it was, for me, this was a great motivation and inspiration again. She injected me with motivation, her commitment and readiness to help in any way possible. That's why her and many of you, when I see, I believe that we can do it. So please join us in making cervical cancer history. We have all the means. The diagnosis, treatment, vaccination. What is remaining is our action. And through this gathering, I can see that we're ready for action. Let's make it happen. Thank you so much. Thank you. Sorry, before I pass over to the chair, Dr. Fikri, the former regional director of EMRO WHO, died last year, as you remember. It was actually in Montevideo. He was flying into Uruguay to attend the NCD meeting. I arrived an hour before his planned arrival, or the arrival time of his flight. I was expecting him to have our pre-meeting and even preparing documents for him. But instead I got bad news that he actually died almost during landing. Of course, the attack started a bit earlier. And it was a terrible time then. Of course, we were focused on NCDs, but another, it was NCD that took the life of our friend. And his replacement is being voted in today. And I wish, I would have loved it to be with you, but that's also a very important issue. You're in good hands, so if you allow me, I will be back there to EMRO to continue the election of the new regional director for the Eastern Mediterranean region. So I just raised this in order to ask your excuse and to allow me to go. And of course, being really unhappy to leave this place where my heart is also. Thank you.